Osteoarthritis, or OA, is one of the most common and disabling joint diseases worldwide. It affects millions of people, especially older adults, and leads to pain, stiffness, and reduced mobility. The burden of OA has been rising rapidly, impacting not only individuals but also healthcare systems and economies. Among the various types of OA, knee osteoarthritis, or KOA, is particularly prevalent and often leads to significant discomfort and loss of function. Managing OA effectively is crucial for improving quality of life and reducing the societal impact of this chronic condition. Obesity is a well-established risk factor for the development and progression of knee osteoarthritis. Excess body weight increases the mechanical load on knee joints, accelerating cartilage wear and worsening symptoms. Studies have shown that maintaining a healthy weight or losing weight can significantly reduce the risk of developing KOA and slow its progression. However, achieving and sustaining weight loss is a major challenge for many people, especially those already dealing with OA-related pain and limited mobility. Glucagon-like peptide-1 receptor agonists, or GLP-1 RAs, are a class of medications originally developed to treat type 2 diabetes. These drugs help regulate blood sugar by stimulating insulin secretion and reducing appetite, which often leads to weight loss. In recent years, GLP-1 RAs have also been approved for weight management in people with obesity. Their ability to promote significant and sustained weight loss has sparked interest in their potential benefits for other conditions linked to excess weight, such as knee osteoarthritis. Better understand the impact of GLP-1 RAs on knee osteoarthritis, researchers in Shanghai conducted a large prospective study. The Shanghai osteoarthritis cohort included over 40,000 adults with clinically diagnosed OA, focusing on those with both KOA and type 2 diabetes. By tracking these patients over several years, the study aimed to determine whether GLP-1 RA therapy could modify the course of KOA, especially through its effects on weight loss and joint health. Study enrolled KOA patients with comorbid type 2 diabetes who had at least 5 years of follow-up data. Participants were grouped based on whether they received GLP-1 RA therapy for diabetes and weight management. Those who had secondary OA, advanced or minimal KOA, or history of knee surgery at baseline were excluded. This careful selection ensured that the study focused on patients most likely to benefit from weight-related intervention. Researchers assessed several key outcomes to evaluate the impact of GLP-1 RA therapy. The primary outcome was the incidence of knee surgery, including total knee replacement and other procedures. Secondary outcomes included the use of pain-relieving medications, the number of intra-articular therapies, patient-reported outcomes using the WOMAC index, and changes in knee cartilage thickness measured by MRI. These comprehensive measures provided a detailed picture of disease progression and patient well-being. Results showed that patients receiving GLP-1 RA therapy experienced significantly greater weight loss compared to those who did not. On average, the GLP-1 RA group lost over 7 kilograms more than the non-GLP-1 RA group. More than half of the GLP-1 RA patients achieved clinically meaningful weight reduction, while only a small fraction of the control group did. This substantial weight loss is a key factor in the observed benefits for knee osteoarthritis. One of the most striking findings was the lower incidence of knee surgery among patients treated with GLP-1 RAs. Only 1.7% of the GLP-1 RA group required knee surgery during follow-up, compared to 5.9% in the non-GLP-1 RA group. It suggests that effective weight loss through GLP-1 RA therapy may help delay, or even prevent the need for invasive surgical interventions in people with knee osteoarthritis. Patients using GLP-1 RAs also reported improvements in pain and physical function, as measured by the WOMAC index. Both total scores and pain subscale scores improved more in the GLP-1 RA group than in the control group. While the differences were statistically significant, the clinical impact was modest. Still, these improvements contribute to better quality of life and may reduce the need for additional pain medication. MRI scans revealed that GLP-1 RA therapy was associated with a slower rate of cartilage loss in the knee joint. Cartilage loss velocity was significantly lower in the GLP-1 RA group, suggesting that these medications may help preserve joint structure over time. Protecting cartilage is crucial for maintaining joint function and delaying the progression of osteoarthritis. GLP-1 RA therapy led to a decrease in the use of pain-relieving medications and intra-articular steroid injections. Patients required fewer oral and topical NSAIDs, as well as fewer steroid injections, after starting GLP-1 RA treatment. This reduction in medication use not only reflects better symptom control, but also lowers the risk of side effects associated with long-term pain medication and steroid use. Study found that the benefits of GLP-1 RA therapy on knee osteoarthritis were largely mediated by weight loss, rather than by improved blood sugar control. In fact, about one-third of the reduction in knee surgery risk was directly linked to weight loss. This highlights the importance of addressing obesity and managing KOA, and suggests that GLP-1 RAs could be a valuable tool for patients struggling with weight management. While GLP-1 RAs may have some direct anti-inflammatory and cartilage protective effects, the study did not find strong evidence for benefits beyond those achieved through weight loss. More research is needed to determine whether these medications can directly modify the disease process in osteoarthritis, independent of their impact on body weight. It's important to note that this was an observational study, not a randomized controlled trial. The participants all had both KOA and type 2 diabetes, so the findings may not apply to everyone with knee osteoarthritis. Additionally, the reasons for starting GLP-1 RA therapy varied, and not all patients had complete imaging data. Despite these limitations, the study provides valuable insights into the potential of GLP-1 RAs as a disease-modifying therapy for KOA. Summary: GLP-1 receptor agonists show promise as a disease-modifying therapy for knee osteoarthritis, especially in patients with obesity and type 2 diabetes. Their ability to promote significant weight loss translates into reduced pain, slower cartilage loss, and fewer surgeries. However, more research is needed to confirm these findings and explore their effects in broader patient populations. For now, GLP-1 RAs offer new hope for improving the lives of people living with knee osteoarthritis.